So today we had the appointment with the geneticist, and he gave us the full report of the analysis, and he went over some of the information and what each means. So pretty much her deletion is right here, from this to here, and then her duplication, it's on chromosome 12 from here to here. And then that's how big it is. That's how yeah, so on the 12 chromosome, it's missing, and then it's 8.2. I believe he said metabase or the extra. He also gave us this article. So he highlighted some things. So with the deletion, with number 12, it's only been reported with 12 patients worldwide. So that's not very many. And some of the characteristics of these patients were speech delay, intellectual disability, of variable degree, so from mild to severe, and behavioral abnormalities. So those were some of the things in common. He also mentioned, at birth, that one of the patients manifested severe breathing and feeding problems, and was in the NICU for 10 days. So with Samara, she did require oxygen when she was born, and she did stay in the NICU for about 5 or 7 days. She did have feeding problems. Whenever she would eat, the milk would spill out. She would choke a lot, and she would vomit. Also, the doctor mentioned that some of them are very small too. And another of the other things, characteristics are hypotonia during laxity, and I guess global clumsiness. So at this time, we don't really know what's going to happen and how she's going to develop. So right now we just have to wait and take it day by day. He did say treat her like a normal baby, of course, with giving her the therapies. She does have an OT appointment, and we did go to get an evaluation at the regional center, and she will be seeing a physical therapist. So the doctor was glad to hear that we do have some plan for her. But at this point, we really don't know how it's going to be affected, especially with chromosome 13 duplication. We don't know how it will affect her, since she's the only one in the world, well, the only case that has been reported. So they don't know. They don't know what's gonna happen. As far as her motor skills, she's really good. As you can see, she can roll over from back to front and front to back. She's very strong. She's very alert. So she's pretty good right now. Yesterday at the regional center, she did score a little bit low on the communication, cognitive, and I believe she said self help. She scored at 2 and 3 months there instead of the 5 months that she is. But her motor skills were right on track. She scored at a 5 month level, which is good. And soon she will be getting tested for her vision, her hearing, and the doctor also recommended a scan of her heart just to rule out any abnormalities with her heart. But that's Samara. Hi, Mama. ¿Qué haces? What are you doing, Mama? So, yeah, so that's pretty much it. And this is, like I said, the paperwork that we were given. This is, so those are the chromosomes that for her, they were affected, all of this. So as you can see, all of these cases that were reported, they all have very different variations. So the closest one to her, I guess, would be this one and the last one. So, I mean, even though the last one has a little extra, but those are like the closest one to her. But we pretty much have to treat her as an individual and take her day by day. So, yep, that's it.